Hey guys, this is Dr. Hub. Today we'll look at the treatment of TB and we are just focusing on the first line drugs. So to begin with, we look at isoniazid. So the isoniazid, it is the mechanism of action being, it is bactericidal. Then other thing is it blocks the mycolic acid synthesis. It blocks the mycolic acid synthesis. And what is the location of the mycobacteria? The location will be, it is intracellular as well as the extracellular. Then comes the use of metabolism. So in terms of metabolism, it is the liver, and there is also a unique side effects. What are the unique side effects? So metabolism was the liver. The unique side effects, it includes the shoulder hand syndrome, and also the CNS side effects. So what is the mechanism of resistance? The mechanism of resistance, there is a clat G mutation. There is a clat G mutation, and this is the most severe form of resistance. The most severe form of the resistance. And then comes the presence of INHA gene. So INHA gene overexpression confers cross resistance with the ethionamide. So the INA gene overexpression, this leads to the cross resistance. It leads to cross resistance with the ethionamide. Next we move on to the R, that is a rifamycin. So what happens in rifamycin? Rifamycin, the mechanism being, it is bactericidal. So bactericidal, it is maximum. Then there is inhibition. The inhibition of the RNA polymerase. There is inhibition of the RNA polymerase, and this leads to inhibition of the RNA synthesis. Inhibition of the RNA synthesis. Next we look at the location of the mycobacteria. So the location of mycobacteria, it is intracellular as well as it is extracellular. Then what about the metabolism? The metabolism is that in liver it is maximum. Now let's look at the unique side effects. So in isoniazid, it is the shoulder hand syndrome and the CNS side effects. In rifamycin, the unique adverse effect is going to be it is orange urine. It has orange urine or sweat and tears as well. And there is other special feature is that there are flu-like symptoms, presence of flu-like symptoms, and this is with the intermittent dosing. Then we look at the mechanism of resistance, MOR. The mechanism of resistance, there is a mutation, and this mutation is of the RPOB, and this is the gene encoding for, it is the gene, and this encodes for the beta unit. It encodes for the beta unit, and it is a beta subunit of the RNA polymerase. Then we move on to P for the pyrazinamide. So pyrazinamide, what is the mechanism? The mechanism is that it is bactericidal, and there is also inhibition of fatty acids. There is inhibition of the fatty acids synthase, fatty acid synthase 1, and it leads to the inhibition of the cell membrane. And what does it do? It inhibits the cell membrane. And what is the location of the mycobacteria? The location of the mycobacteria is going to be intracellular. Then what about the liver? The metabolism takes place in the liver. So the unique side effects will be the pyrazinamide is going to be the most hepatotoxic, and it is the most hepatotoxic. It is also causes a hyperuricemia. Next comes the mechanism of resistance. The MOR, there is a mutation, and there is a mutation of the PNCA gene. Now let's look at the last drug we are going to see is the ethambutol. So here in ethambutol, the mechanism of action. So till now we saw everything was bactericidal, and ethambutol is going to be bacteriostatic. It is bacteriostatic. So bacteriostatic means there's a inhibition of the arabinosyl transferase. So inhibition of arabinosyl transferase, and this leads to reduction in the arabinogalactan, which is needed for the cell wall. It leads to the reduction in the arabinogalactan, which is needed for the cell wall. So then comes the question on the location. The location of the mycobacteria, it is going to be extracellular. Till now we saw it was mainly in intra and extracellular in iso and rifamycin, and pyrazinamide is intracellular, and ethambutol is going to be extracellular. And what about the metabolism? The metabolism, we saw that it has been taking place in the liver, and here it is the kidney. So in ethambutol there are slight variations. So what are the unique side effects? Unique side effects, it includes the optic neuritis. Easy way to remember is all, right? It ends with OL. So it's optic neuritis, as well as it is because of this it is not used in children as well, not in children. Next is, how is the mechanism of resistance? Mechanism of resistance, we call it the MOR. So in terms of the MOR, that is the mechanism of resistance. It is a mutation in the EMB gene.